Testicular cancer is a disease of young adults, young men. The presentation is totally different to prostate cancer. So testicular cancer patients present with usually a palpable lump in the testis. Often self-examination and awareness of that can lead to early diagnosis and better outcomes and curative treatments. So predominantly the symptoms are lumps in the testis or painful testicular lesions. Testicular cancer can be diagnosed early if men are aware of that specific tumor, which is very common in young men. We need to be aware of the fact that any abnormality, any new lumps or painful lesions on the testicular area need to be looked into, and an early consultation with a GP, if one has symptoms like that, can save lives. Patients most at risk of testicular cancer are those who had, as a child, undescended testes and underwent orchidopexy, or those who have a family history of testicular cancer. Over the last few years, we've seen an increase in the number of new testicular cancer cases. Probably has to do with environmental reasons rather than anything else. But young men are the ones most at risk. Testicular cancer is diagnosed using an ultrasound scan and clinical examination. It cannot be misdiagnosed for prostate cancer, but it is something, it's a diagnosis that needs to be considered in any young or middle-aged man who presents with a testicular lump. The majority of patients who are diagnosed with testicular cancer are cured. Depending on the stage of presentation and the risk stratification scoring system as well, cure rates could be usually in the range of 90%. Again, depends on the stage and the stage of disease at presentation. Treatment options are predominantly surgical, so orchidectomy is the most commonly offered treatment, the one that is the baseline. Following that, other treatments are given either to treat metastatic disease or to prevent metastatic disease. So the treatment for testicular cancer can be either adjuvant or curative. So adjuvant treatment predominantly includes the use of chemotherapy agents such as carboplatin or bleomycin or cisplatin, and that is given as a preventative treatment. But furthermore, treatment for testicular cancer can be for metastatic disease, in which case chemotherapy is highly effective and highly curative. Some patients would require further surgery, apart from the orchidectomy, might require further surgery with retroperitoneal lymph node dissection, which is performed by specialized surgeons. But predominantly, patients are cured with a good use of all those treatment modalities.